Alright, hello everyone, this is Dr. Tushar Mehta. I'm an orthopedic surgeon and your faculty of orthopedics, and now we'll have a discussion on this question. So I'm sure you all can read this question very carefully. It says that there is a 32-year-old female coming to you with a chronic back pain. There is evening rise of temperature. Along with that, there is loss of weight, or they could have said loss of appetite as well. Now, X-ray of the spine shows destruction, it's a very classical word, of anterior vertebral body with reduced disc space at thoracolumbar junction. What is the most likely diagnosis? Well, first of all, I would like to use this opportunity to tell you all that this is one of the most frequently topic from which MCQ is asked. I have seen in last so many years, almost now to 2 decades now, that something related to this comes, and these are the options which are given. So first of all, if they are talking about weight loss, if they are talking about appetite loss, if they are talking about evening rise of temperature, or what you call as evening pyrexia, or they are talking about night sweats, plus if they are talking about X-ray shows destruction not only of the vertebral body but also in destruction of the intervertebral disc. So all these things classically go towards the favor of this diagnosis called as tuberculosis of spine. And one more thing I must appreciate, that most common site of TB is lower thoracic spine, followed by upper lumbar spine, followed by thoracolumbar junction. So definitely in the question they have also mentioned thoracolumbar junction, so that makes it very clear that we are talking about. If they would have asked a question on ankylosing spondylitis, they would have mentioned stiffness in the back. They would have mentioned HLA B27, and they would have mentioned some particular finding of Angspond and X-ray spine, out of which bamboo spine is a very common thing. They would have mentioned that early morning the patient finds it very difficult to get out from the bed, which is called as morning stiffness. But have they mentioned anything like this? Well, I'm afraid no. So it is not ankylosing spondylitis. Metastasis. Yes, first of all, it can be metastasis. Female, of course. 32, of course. Chronic back pain, of course. But evening rise of temperature and weight loss, very unlikely of metastasis. But weight loss, metastasis, cancer. So how do we differentiate? In intervertebral discs, in metastasis, intervertebral disc space is preserved. There is a very old saying, disc space preserved, bad news. Disc space destroyed, good news.
Stop.
Very ironic. Disc space destroyed is a good news, because disc space is usually destroyed in tuberculosis, which is treated fantastically with ATT. Disc space preserved is a bad news, because usually it is preserved in metastasis or tumors, which is of course a bad news because that carries a poor prognosis. I hope you understood the concept. Pyogenic spondylitis, anything related to infection in the blood has to be there, some primary infection has to be there, or something like that. So answer to this question is very clear, tuberculosis of spine. So that is the entire purpose of this video, that is to tell you that okay, this is the correct option, fine, but why the remaining 3 are not correct? And that is, if you learn that art, believe me, you will learn to understand the technique of solving an MCQ.